I'm hearing some echo. Actually, is it to say one thing? I was really surprised because the process looks like simple. We are having some partnerships with different countries. I'm surprised because you are hiring from different countries, and I saw the process. You will hire, and there are conditions like the language exam. What about the? Is there any comparison between the programs? I mean, for example, if I compare with the German market, I know there is a gap between our program and their program. So one condition is to fill the gap. What I want is to rassurer, how to say, rassurer our students and to prepare them to feel confident, because it's like sending them to an environment they don't know, an unknown environment. So our role as employability direction is to prepare them and give them all the information. So my question is, what happens once they pass their language exams on all the exams? There is a process of recruitment, and as an HR expert, this is my concern, or the question I want to ask. So what do you hire for? What are the soft skills we need to prepare them on? What are the professional skills required or which are mandatory? I don't want them to launch the process and they progress, and then they discover there are some mandatory behaviors maybe, or professional knowledge which is required by the UK environment for paramedical.
Roderick can answer this question. Sonia, the reason the nursing and midwifery council, they have the exams is to make sure that these people who are coming to work in the UK and who are going to care for patients in the UK are safe. That's number one, which means that they have the same competencies as somebody who qualified in UK. And that applies the same for doctors. Doctors, they got the blood test. And the blood test is, for doctors, is almost the same. So you have to do the English and you could take blood 1 and blood 2 now. And these exams are there. It's the only way you can say whether this person is qualified to work in UK or not. You can look at the council can look at your curriculum in Tunisia, or they can look at the curriculum in Morocco, but that doesn't mean anything. They want the person who is coming to work, they are able to pass the exam, because once they pass the exam, that means they are qualified. And the exam is a mixture of technical and non-technical skills. So they are going to test them on their knowledge and their competencies in nursing, and they are going to test them on the non-technical skills in matter of communication, of behavior, and in the all of the other. And that's what is the exam. So the exam is very objective. It's very in matter of and that's probably one of the best services we offer as for Better Health, because if you remember, we are aiming to work with schools to fill the gap, and that we are aiming mostly to do that with from year 1. So probably we would be we are ambitious that we get 25 or 50 by the end of the year for people who are really advanced. That will be really ambitious, but our aim is to work with schools from year 1 in matter of feeding them with the information or the what they need to prepare candidates. And I think when we talk about year 1, so it just add in what you have in your program, and you do it in French if you want to. So but already people they know this is the level, and I can tell you the level is high. As you know, it's all about services. It's about you got the knowledge, you need to know how to apply it properly to our patients. So as I told you, from April we will feed you with some information about what is expected for the exam, and normally what is expected for the exam is what people need to start preparing for now. So we know that there is in the exam there is a station which is about communication. And of course, communication is not just a language, it's different aspects. of communication. The communication it could be just simple about the body language, or a situation of anger, or a situation of breaking bad news, or a situation of explaining to the patient, or taking a consent. So it's a whole range of things which will, and we would like that people start preparing in your school from year 1 to that. So when they come to year 3, they are really perfect.
Yes, that's, we share the same vision. And what happens if someone fails at the exam? Is it rejected, or does he receive just a score, or like a feedback who could help him to take the exam?
I would probably answer just a part of the question, because as I told you, hospitals, they got interest for the candidate to pass, so they work with them for 6 months. And when I think that when they fail first time, they take the exam second time. I don't know how many. Is there a limit, Roderick or Isa?
3 times. But it's very rare, actually. In my recruitment in my department, hardly most of them pass the second attempt. It's only one person that fails in the third, in the second attempt, was asked to go for the third attempt, and the reason being that he made a representation about the timing or something like that. Maybe the writing wasn't very clear, so he made an appeal to the NMC, and she was asked to retake it again. So it's very rare. Almost all the people that come into my department pass at the first attempt. On second attempt is rare, but they do. But they allow third attempt. Yeah.
And also, if I also can add, because I've been recruiting in the Philippines, and the recruits that I've had so far, majority of them passed the first time. There's a couple of them who had to take the second exam, but the good thing about when you fail on the first exam, they will give you feedback as well and tell you what areas you fail, and then you can just improve on that, or maybe you can get your preceptor or your mentor to show you more or tell you more, or you can read more about that area that you failed, so that when you take the second exam, you know that you're confident that you've passed the other areas, and this is the only area that you need to focus on. So there's a lot of support, like what Ahmed just mentioned. The interest of the employer is for you to pass the exam, so they will do everything in the to get you a good preparation before you venture into taking the actual exam itself, and you've got 6 months to prepare for that.
Yeah, like my trust, there's specific manager who is in charge of that to ensure that the staff actually are supported. All right, and they call them oversee facilitator. There's a matron who is actually superseding something, and we have all the practice educators trying to have some simulation with them within the lab, within the hospital, so they are familiar when they go for the exam. And that's why we have a lot of high pass rate in my trust. So that is so they're there because they don't want to spend so much money themselves to be able to go there and register you in the council, with the exam, the university that does the center that conducts the exam. So it's always there. The support is there.
So we can you just remind you that this is just the first series of webinars. We are going to have a monthly webinar the first Saturday of every month for this sort of question answers, because we know that this is new to people, and to give the opportunity to people to ask the questions and know more